Welcome when joining us on the EAS Conference 2015 in the fabulous town of Glasgow. We're actually here at the EAS, and guess what? It's all about lipids. We heard that the pendulum, which tended to go to HDL increase, has now been boosted back, and we're currently all the way back to LDL lowering. And then what's there for LDL lowering? Statins, and high dose statins. Then there's an issue. If we only have statins, what should we do with this increasing amount of subjects who actually don't dare to take statins because they think they have side effects of statins? Well, that's a big issue. Why is it an issue? Well, we learned that if you don't adhere to your statin therapy, your mortality actually increases. So what should we do here? First of all, we should note that statin intolerance is not fully evidence-based. It's a subjective amount of complaints which you can actually not measure. The vast majority of patients with so-called statin intolerance, or better said, statin-attributed muscle symptoms, they actually have no CK elevation. So there's no objective way of dissecting those who think they might have muscle ache due to statins and those who maybe really have muscle ache due to statins. So how should we go about? Well, actually there was a very good satellite where we discussed all the ins and outs of statin intolerance. We first of all learned that it's a meticulous clinical workup. You should always counsel the patient and make sure that you explain again and again and again that there's a very good scientific rationale for the beneficial effect of statins. Also explain that perceived side effects due to statins don't have to be due to statins. You should do everything in your power to make sure that patients keep on their statins. And if they don't want to continue their statin, actually try a de-challenging period and then again a re-challenge. Either even with a low-dose statin or alternate day dose statin, try to actually do it again and again and emphasize that if you re-challenge, actually up to 90% of patients may actually be in fact do well after a year and still use the statin. So then what do we do if we tried everything? We did a clinically restriction to a careful de- and re-challenging protocol, but still it won't work. In those patients actually now with new agents, for those highly selected patients, we can also address the issue successfully in those patients. But we have to be careful. We can't put all the patients with a single complaint on statins and new agents. We can't afford it. So we will actually discuss all the pros and the cons, how to go about with the approximately 40% of referrals to lipid clinics by patients experiencing side effects of statins. We have to take it very serious, but we also have to make sure that we will stick to the evidence. You can read all about these data in the recently appeared European Heart Journal Consensus paper by the ESC and EAS, which gives you a very nice overview of this complicated but challenging area.